Hi there, how are you doing today? My name is Diamond. I'm going to be taking care of you. I see that we are doing a cleaning, so we're going to brush, do a little bit of scraping, make sure there's no plaque on your teeth. Then we will brush them good. And after that, do you want it to do the whitening treatment? Okay, perfect. I'm going to start with putting my gloves on. How has your day been so far? Oh, good. And after this, you'll have some nice pearly whites. That'll make your day even better. You can smile even brighter. Alright, just bear with me. Sometimes my hands just don't want to go in here without a fight. There we go. So what I'm going to start with is I have some tools here. Have you seen these tools before? Okay, I figured. But they are just going to be our exploring tools. And all I'm going to do is just have you open up. I'm going to check your top teeth first and then your bottom. What I'll be doing is just kind of tapping on your teeth. And I will first go through, tap each one and make sure that you don't have any loose teeth or any problem areas that I see right away. If you don't, then I'm going to go back in with the same Explorer and just do gentle scratching motions like this. And what that's going to do is pull off any plaque that's on your teeth. Okay? Yeah, so today we're not going to use the water pick. Are you talking about like the sharp tool that the water shoots out of and it goes along your gums and freaking hurts? Yeah, we're not going to use that today. We're going to be more innovative and do it by hand. And then this is just my mirror here so I can see what the heck we're doing. So let's go ahead and get started. Do you have any other questions before we start? No? Okay. Alright, so what I want you to do, go ahead and just give me a nice smile really quick. Alright. Very nice. You have wonderful teeth. Alright, go ahead and tilt your head back just a bit here so it's on the headrest. There. And what I'm going to do is have you open up. Good. And I'm going to start with these teeth back here in the back. Coming around to the front here. And open just a little bit wider. Perfect. Good. No loose teeth on top. Now go ahead and relax your mouth just a bit. You don't have to be so wide for the bottom. Good. Check in the back here first. Coming to the front. Okay, everything looks good there. No loose teeth. No cause for concern from anything I can see right away. Now, my question for you is, do you feel like you have any teeth that are either bothering you, maybe sensitive to hot or cold, anything at all? Or do you feel like everything's pretty neutral? Okay. Let me take a look. Which tooth is it? 1 tooth, the third one. Okay. And what does it feel like? Some pressure, maybe? Okay. Well, my question then is this. Do you think, have you ever found yourself grinding your teeth? Okay. Super common. It happens to so many people. I myself have to wear a night guard every night because I grind my teeth so vigorously. So it is very common. But sometimes what can happen is we get inflammation. Everything kind of gets inflamed when we grind our teeth. Sometimes people have gum recession from it. Other people have sensitivity. It can also cause cavities. Lots of things. So we want to make sure that there's nothing else going on in that tooth, but I'll evaluate good from the outside. And just make sure that it might be just from grinding, okay? Alright, perfect. Okay, so I'm going to take this paper towel here, and this is what I'm going to use to just wipe off any of the plaque that we get from your teeth. So I'm going to hold that in my hand here. And now is what I mentioned. I'm just going to do a little bit of scratching, scraping. Nothing vigorous. It shouldn't be painful. If you do feel any pain, just raise your hand, let me know. But I don't think you will, okay? Alright, so let's start at the top back here in the back. When's the last time that you had a cleaning? Okay. Yeah, you don't have too much plaque at all so far. Doing okay so far? Alright, good. Just checking. Getting up here to the front. Alright, and turn your head just a bit that way. I'm going to start working my way back on the top of this side. Very minimal, yeah. There's not much plaque at all, which is great. And the last two teeth up here in the back. And the final one. Go ahead and open real big. Perfect. Same thing on the bottom now. Exact same thing. I'm going to start with this side since we're already over here. And I'll work my way back. Okay. Fold that over so we get a clean side. Okay, so starting down here on this bottom side. We got a plane flying over. Quite loud, right? Yeah, I always complain because even though this office isn't close at all to the airport, and by not close I mean literally 25 minutes away, all the planes still fly over. We're right in the flight path. So nice 100 times a day we hear the planes. Okay, getting here to the bottom front. And then turn your head back this way. A little bit more, a little bit. Perfect. And just 2 more over here on this side. Last one in the back. Sorry, I know a lot of people really don't like that screeching sound. I don't either. But good. That is that. We are done scratching and scraping. Everything looked good. I don't see any visual cavities. If you want, we can take x-rays, but if nothing's bothering you, do we really need to? No, probably not. But if you want, obviously we can. However, I don't see any type of bad staining, any broken fillings, any cavities, nothing that I can see. You're not having any pain sensitivity or anything wrong, except maybe a little pressure in that tooth. Why don't we watch that and make sure that it doesn't get any worse, okay? Sounds like a plan. If it does get worse, come back. We'll reevaluate and see what's going on, okay? Alright, sounds good. Next thing I'm gonna do is take these little brushes here. Have you used a floss pick before? Maybe, maybe not. They're these little things here. Probably can't even see them too well. And they come in a pack of a bunch of them. These are good for basically getting all of the food particles out from between your teeth, and because they're like a little nubby, they stimulate your gums as well, which we need because it'll help with periodontal disease, which is gum disease, also gum resuscitation. So what I want to do is go ahead and just take one of these brushes and floss your teeth quick, and then from there we're going to just go ahead and do a nice brush and then put on the whitening treatment. So go ahead and open big. I'm going to start with the top side over here. Let me know if this is uncomfortable. Shouldn't be. These are very soft bristles. Okay, 2 more. Good. Now I'm going to grab a different one for the bottom. Same thing, just a new brush. Go ahead and open. I'm going to do the same thing just as I did on top. Didn't hurt, right? Good. It's not supposed to be uncomfortable or painful. Okay, coming to the front here. And starting to go around to the back. Just 2 more over here. Last one way in the back. Perfect. Now, you did amazing with that. No gum bleeding, which means your gums are not inflamed or irritated from what we can see. I hope you are okay with a purple toothbrush. That's the only color we have left in stock. Everyone has taken the pink, blue, red, orange, and green. Left us with purple. So is that okay? Alright. What I'm gonna do is go ahead and get that brush wet. Okay. That'll do it. And now we will add on the toothpaste. The one that we are using is the Colgate Max Fresh with Whitening Knockout. Helps destroy nasty odor and fight lingering food aftertaste. This is a brand new one. Brand new. And we're just going to go ahead and put that on. Like so. Smells super minty, super fresh. I can smell it through my mask. That's how strong it is. Alright. What I'm gonna do is just start brushing this on your teeth, okay? Open peek. Alright. Making sure we really scrub them, not too hard though. You always want to be nice and gentle. You don't want to just vigorously rip back and forth because that will definitely irritate your gums. It might even remove too much of your enamel, and we don't want to damage your enamel because that's when cavities and porous enamel happens. Okay. And that looks pretty good. Alright, go ahead and spit in that sink next to you. You can also rinse your mouth out now, and I will prep the whitening agents. Okay, feel nice and clean, everything's rinsed out. Peekaboo. What we're gonna do is dry off your teeth a bit with this paper towel. I'm going to be using a whitening pen to paint in between the cracks of your teeth. And then we will be using dental whitening strips, which are going to go on both top and bottom. We'll leave these on for about 15 minutes, okay? And then I will come back in, remove those. You can rinse your mouth out a little bit, and that's it. You want to try not to eat or drink for about like 1, 2, 3 hours if possible. You can drink water, but don't just go and drink some Dr. Pepper because it's a little bit rough on your enamel, especially after bleaching them. So here we go. I'm just going to take this paper towel and blot your teeth. Go ahead and smile. I'm going to wipe a little bit to wipe. I know it feels super weird to have your teeth all dry and weird, but I promise the whitener is going to stick much better to dry teeth. So let's get that off. And we're twisting until the product comes out the top. Okay. Perfect. See that? I know it's the most annoying sound, takes forever, but it's worth it because this stuff works. Alright, a little bit sticky. Go ahead and just smile. Alright. Okay, and now same thing on your bottom. Let's just paint this on. I'm putting it on pretty generously. Can't hurt anything. Good. Now let's go ahead and put on the whitening strips. The good thing with these is they claim to be enamel safe, so it should not damage your enamel in any way, shape, or form. But like I said, that doesn't mean that you won't have sensitivity, because that does happen. That is a very common side effect with whitening, teeth whitening. So here we go. We're gonna go ahead and put your top strip on first, and then the bottom. Go ahead and open your mouth just slightly. I'm gonna go ahead and put this on your top teeth. Okay, perfect, just like that. And now for the bottom. Same thing, I'm just gonna peel off this piece. Oops. Come on. Doesn't want to come off. There we go, we got it from the other side. Okay, open up. I'm just gonna put these on the bottom teeth. Good. Does that feel comfortable? It feels alright. Okay, try not to talk. There is a small suction there if you need it. I will be back in about 15 minutes to take those off, okay? Alright, be right back. Alright, are you ready to get that whitening strip off and get out of here? Okay, go ahead and open up. I'm gonna peel off the top one first. Oop, they both came off at the same time. Well, good. Less work for us. And let me go ahead and see your teeth smile. Oh, they look really, really great. They've probably whitened about a shade, but the more you do it, the more whiter they will get, okay? Alright, do you have any further questions for me today? No? Alright. Well, let me know if that tooth starts bothering you at all. Please come back, we'll check it out. But other than that, you are free to go. Oh, you're so welcome. Thank you so much. Have a great day.